Do you give me permission for me to record this video and upload it to YouTube for my professor to grade and review?
Yes.
Yes, she verbalized yes. I am also her parent and I consent permission to record this video, upload it to YouTube for my professor to review and grade. My patient is seated comfortably, her legs are supported. I performed all safety precautions. I washed my hands and verified HIPAA. And I will now start my assessment. Hello, my name is Crystal. I will be taking care of you today. Today we will be doing an abdominal assessment. Would you be able to lift your shirt up for me right under your bra? There we go. Let me help you a little bit. There. And we're gonna start our assessment with inspection. I'm going to inspect the abdomen looking for any pulsations, peristalsis, any jaundice that may indicate any liver disease. I'm looking for symmetry of her abdomen. I can see her respirations through inspection. We're also looking for any veins, any ascites. I can also take this opportunity to see if my patient has any scars that may indicate any abdominal surgery, such as appendectomy. I'm also gonna check my patient's sclera in her eyes just to see if there's any jaundice that may also indicate any liver disease. So I'm gonna inspect the sclera by pulling down on her lower eyelid and looking at the color inside the eyelid. So we'll do that. We'll check both eyes. I'll check the right eye first, which is on that side of the camera, and this is her left side on my side of the camera. Okay. Sclera looks pink, doesn't look red. Her eyes look, I see the whitish color in her eyes, no yellow, no jaundice, which is great. Okay, now we're gonna move on with auscultation. So in auscultation, what we're looking for is we're gonna listen to the 4 quadrants in her abdomen and we're gonna look for clicks and gurgles. I'm gonna start by listening on the right lower quadrant, which is on this side. And what we're looking, like I said, is clicks and gurgles, which consist of a frequency of about 5 to 30 per minute. And that would be normal active sound. Any more than that would be hyperactive sound, and any lower than that will be hypoactive sounds. Listening. So I went from the right lower to the right upper, from the right upper to the left upper, and now we're going to the left lower. And we can listen to sounds up to a maximum of 5 minutes before we determine whether the sound is hypoactive, normal active, or hyperactive. We can also take the bell of the stethoscope if we want to look into further and listen with the bell of the stethoscope. Okay, now we're gonna listen, auscultate for the aorta, which is about 2 centimeters above the umbilicus in the middle, right here. So I'm gonna start listening with the diaphragm. And here we're just looking to see if we can hear any bruit. I'm able to hear it. Now we're gonna move to the renal arteries. Here we would also listen with the bell of the stethoscope, the aorta, the renal arteries. I'll go back to the aorta since I didn't listen with the bell. And now I'm gonna move over to the left renal artery. Now we're gonna move down to the iliac artery, which are about 1 centimeter or 2 under the umbilicus in the around the mid-clavicular line, so about right here. And I would be placing my stethoscope on her skin, not over her pants, but for video purposes, I'm putting it over her clothing. go. And now we're gonna move down to the femoral arteries, which are about, I would say, by the iliac spine, about a centimeter towards the umbilicus. Okay, great, no bruits. Now we're gonna move on to percussion. So with percussion, what we're gonna do is we're gonna be looking for any dullness or tympany in the abdomen. We're gonna take our middle finger in the non-dominant hand, and we're gonna strike that distal joint with the dominant middle finger of well, for me, it's my right hand. And again, what we're looking is for tympany, which we should be hearing in hollow organs or like in the stomach where there's is airfield, or for dullness. And I'm gonna start with percussing the right lower quadrant. Okay, great. I did hear tympany, which is, it would be considered normal. Now we're gonna go ahead and percuss for the liver dullness. So the liver is on the right side in her right upper quadrant, which is on this side. And what I'm gonna do is in the mid-clavicular line around the umbilicus area, I'm gonna start percussing upward until I hear that sound shift from tympany to dullness. Right here. So this right here is her liver edge. I can go ahead and mark that area, and then now I'm gonna measure the liver span. So I'm gonna go ahead and about, I would say the 5th intercostal space, I'm gonna start percussing downward until that sound shifts again from tympany to dullness. And I would be doing this, of course, under her clothing, not over her clothing. Okay, and here is her liver span. I would mark those 2 areas, and that would give me the number for her liver span, and that should be 6 to 12 centimeters. Anything above that may indicate an enlarged liver. Now we're gonna go ahead and percuss for the liver, the spleen dullness. So around the 10th intercostal space, right here, we will percuss in the interior axillary line, and we will percuss for dullness. I can go ahead and start my percussion. I can ask my patient to take a deep breath. Take a deep breath for me, please. And percuss. And what I'm looking for is for that sound to shift from dullness to tympany, which indicates that the liver has movement and it is not enlarged. I am now gonna go and move forward with my 3rd step in the abdominal assessment, and that would be palpation. We're gonna start with deep palpation, with light palpation. And here I'm just looking, like getting my patient comfortable with my touch, relaxing her abdominal muscles, and seeing if I find any masses, any distension. So I'm gonna start at the right lower quadrant with just very light palpation. So I went from the right lower quadrant, right upper, left upper to my left lower. Now we're gonna move on to deep palpation. So I'm gonna use both of my hands to basically just press down on her abdomen, and I'm looking for the structures of her organ, seeing if I find anything enlarged, any mass, any pain, any discomfort, any tenderness. So we're gonna go ahead and start at the right lower quadrant, and here we have her appendix in her right lower quadrant. right upper quadrant, we have her liver, and behind her liver, we have her gallbladder. Left upper quadrant, her spleen is on this side. And then her left lower quadrant. Okay, we're also gonna try and find now her liver border and try and see if we can feel that. So we're gonna go ahead and palpate the liver also with inspection, with inspiration. So I'm gonna ask my patient to take a deep breath for me. And right under her ribs here, I can feel her liver. I should be able to feel the edge of her liver. Right under her costal margin in the mid-clavicular line, I should be able to feel her liver. And her spleen should be on the left lower side. When I palpate that the left upper quadrant, I should be able to feel that spleen as well. I should not be able to feel the spleen. If I feel the spleen, then that could be an issue because the spleen is not palpable. In the right lower quadrant, we could do a specialty test to test for appendicitis, and that would be rebound tenderness. So what I would be doing is pressing down on her abdomen firmly and releasing. And when I release, that should cause discomfort, like a pain, and that can indicate appendicitis. So we're gonna go ahead and try that. You have any pain? Okay, she said no pain. We can also do a specialty test, which is a fluid test. And what I would do is I would place the external part of my palm in the umbilicus line and press down firmly and tap, and we will see if that causes any fluid shift. And if there is fluid shift like a wave, then that can indicate that there's fluid accumulation in the abdomen, such as ascites. Another sign that we can do is the Murphy's test. So the Murphy's test is, I'm gonna go ahead and palpate the gallbladder. Sorry, the gallbladder is on this side. Palpate the gallbladder and ask my patient to exhale. Can you take a deep breath for me? And release. And what that should do is it should be able to move the gallbladder down, and when the gallbladder moves down and touches my fingers, that should create pain, which can indicate any issues with the gallbladder. Now we're gonna go ahead and check for CVA tenderness in the posterior part of her body. So I'm gonna have my patient sit up and turn around. Oh, you can stay like that. For video purposes, I'll have my patient remain like this since we're doing the video at a table. And I'm gonna check for CVA tenderness. And what I'm looking for here is to see if my patient has any type of reaction when I do that, which can indicate any kidney problems or problems in her abdomen. I pretty much think that's it for my video. And thank you for watching.